Under the leadership of CEO Dan Helferty, Independence Blue Cross is committed to improving the health and well-being of youth and young people experiencing homelessness. To hear more about these efforts, we are now joined by Reverend Dr. Lorina Marshall-Blake, President of the Independence Blue Cross Foundation and Vice President of Community Affairs at Independence Blue Cross. We welcome her to the panel to share more about their efforts in the community and how they are addressing the health challenges stemming from homelessness and COVID-19. Lorina?
Okay, thank you so much, Caitlin. Again, good afternoon to everyone. And again, I want to thank the National Institute for Health Care Management Foundation for inviting me as a panelist on this webinar. And again, my fellow panelists, I greet you. And Bobby, I learned so much. Every time I think I know something, I learn an additional amount. So thank you for your informative presentation. And then I would also be remiss, I know there are many Blue Cross plans that are along with us. So again, I want to recognize our fellow Blue plans joining from across the country. Again, it said Lorina Marshall-Blake, and I consider it a privilege. Just as I heard Bobby speaking today, the work that I do is a work of passion and love, and serving as the president of the Independence Blue Cross Foundation. And I also have another title, which is Vice President of Community Affairs for Independence Blue Cross. But let me tell you a little bit about the foundation. Again, when we look at collaboration and we look at connection, how do we bring, even as I listen to Bobby, how we bring these different environments together so that they collaborate and they all work together. The foundation is the private charitable corporate foundation of Independence Blue Cross. It was founded with a mission to lead sustainable solutions, and I emphasize sustainable solutions to improve the health and well-being of the communities we serve. And again, it's not about independence, it's all about the community. I always say we're boots on the ground. And we believe in leveraging cross-sector collaboration. So it's not just us, it's others at the table with us to address the greatest health challenges facing our community. And I think it goes without saying that we have many challenges today. And none of us, I think you may join me, can address them alone without working together. But you know who can address them? All of us together. So that's why I'm excited about being a part of this panel. Again, the key is through collaboration and connection. And I'm excited to talk about how we're working with and supporting community organizations who are creating change in healthcare for our most vulnerable population. So again, it's not about us, but it's about all the other people that we are indeed working with. The foundation, what we do, we award grants to community-based nonprofits, privately funded health centers, and accredited nursing programs in southeastern Pennsylvania, which includes Bucks, Chester, Delaware, Montgomery, and Philadelphia counties. And what we focus on, again, is an access to care, the healthcare workforce, innovation in the nonprofit sector, and national health issues. And I think, again, it goes without saying that COVID-19 and homelessness are major healthcare issues. To date, the foundation has awarded more than $40 million in grants to more than 200 partners, reaching nearly 300,000 residents in southeastern PA. Investing in the education and professional development of nurses is one of the foundation's top priorities. I think with this COVID-19, we have seen how vital nurses have been to this whole pandemic and epidemic and being on the front line. And again, when I think of nurses, they're compassionate, they're caring, their lenses, they bring their skill set, but they also bring compassion with it. Through our Nurses for Tomorrow program, we partner with national nursing organizations, nurse leaders, and regional nursing schools to prepare the next generation and say that looking forward to the next generation of healthcare heroes through grant making and leadership opportunities. Under the umbrella of Nurses for Tomorrow, our nursing internship program, and I'm delighted to say that I have, even with the pandemic and even with COVID-19, I have 30 nursing interns that are working with me this summer. The program is designed precisely for undergraduate nursing students who seek to understand non-traditional roles in nursing. Through our Blue Safety Net program, we fund nearly 50 community health centers providing health care to medically underserved populations. And what happens with the students who come in, many go into our clinics, and many times they change their whole focus, and they want to become community health nurses or public health nurses, as opposed to going to pediatrics and others. Our Community Innovation Program funds pilot projects that address health challenges in a new way. And our Addressing Health Priorities program aims to find local solutions to national health issues. And one of them is through our STOP program, Supporting Treatment and Overdose Prevention, or STOP initiative, is focused on the opioid epidemic. And we are responding to the COVID-19 pandemic by continuing to support community organizations that are providing essential health and human services. And one of the that we're working with is called the Black Doctors COVID-19. And it's a group of a woman by the name of Dr. Ayla Stanford, who now goes out into the community and does the testing in less than, it hasn't even been 2 months. She's tested almost 5,000 people, and she's going to areas and zip codes that traditionally that folks don't go to. So we've been very supportive of her efforts because we realize how important it is. And it's not just one, it's all. In addition to grant making, the foundation ran 3 campaigns in 2019. One was our Nurses Can, which was an inspiring and empowering current and future nurses to pursue roles beyond the traditional care setting. Reaching communities highlighted the work of health centers in our region and the diverse community they reach and serve. And I say, if you've seen one health center and we support 50, you've seen one health clinic or one health center. They're all different. They're not the same. And then there is our Someone You Know, which was a grassroots public health awareness campaign, reducing the stigma of opioid addiction. And really, we went to change the narrative. We went to Washington. We took it to the halls of City Hall. We actually went back out into the community, and we didn't tell the story. We had 20 ambassadors who told their story, what they were living with and what they were dealing with. And even in some cases, going back to what Barry was talking about, some of them were even homeless, but now are in a much more positive setting and working with a group called One Day at a Time. Again, it's about reducing the stigma of opioid addiction, inspiring hope, and empowering others to seek help and treatment. However, as I say, we are more than a check. We are more than just funds. I tell people, I don't just want to date you. I want to have a marriage. How can we work together and collaborate together and combine our efforts to make things better? Like our parent company, Independence Blue Cross, the foundation is a convener of diverse organizations, a force for new ideas. I'll tell my staff, no, people say, let's think outside the box, to which I respond, we don't have a box. So let's come up with something that really makes a difference, and it doesn't have to be what everybody else is doing. Again, we're a thought leader in addressing emerging health needs in the southeastern Pennsylvania region. It has been said, Margaret Mead says, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I feel we have a responsibility to act as a leading voice to address the biggest challenges facing the health of our communities. And we leverage the voice of our community not only by speaking about the needs of the community, but by hearing. Again, going back to Barry, we need to listen. We need to we should not be doing just the talking. We need to go into our communities and listen and hear what their concerns are and how we work together to affect change. But by hearing the needs of the community, funding through grant making and actively participating in solutions to drive change and to shape public health in our region. And I really believe we have a responsibility to do that. We understand effective health care goes beyond what happens in your doctor's office. And again, going back to Barry, and if you're homeless, you don't necessarily have a doctor's office. One of the things about the Black Doctors COVID-19 is that they went directly to the shelters. They went directly to Love Park where the homeless were. And we were we were helpful in helping them get there with supplies and everything else that they needed. Our health is shaped by our community and the resources around us, or the lack of resources. The discrepancy in medically underserved communities are unacceptable, and I'd like to highlight again a few community organizations supported by the Foundation who are addressing the health needs of individuals who are homeless. And while I focus on the support of the Foundation, I want to begin by talking about a well-renowned nonprofit supported by independents and the Foundation. And many of you may already know Sister Mary Scullion, Project Home, has helped thousands of people break the cycle of homelessness and poverty by providing a continuum of care. And that's the key thing. You don't just stop and start. You're talking about a lifetime. This includes street outreach, supportive housing, and comprehensive services that focus on health care. They focus on education and employment through both adult and youth education and enrichment programs. Project Home and its partners have pledged to end chronic street homelessness in Philadelphia. And if you know Sister Mary Scullion, you know that's what she's going to do. In January of this year, Independence, Project Home, and AmeriHealth Caritas launched the Keystone Connection to Wellness, an initiative to address the significant health disparities in life expectancy and infant mortality experienced by North Philadelphia residents, connecting Project Home patients with resources beyond their immediate medical needs. With financial and operational support from Independence and AmeriHealth Caritas, Project Home will work with other social service and health organizations to form a robust association of services to address social determinants of health. Additionally, this initiative will launch and facilitate a community advisory board. Again, you heard Barry talking about an advisory board to help guide priorities and build on neighborhood strength, focused on improving health and quality of life for residents who live in 2 targeted zip codes of North Philadelphia. So again, listening and then affecting change based on the conversation. This is one example of how we work together to address the impact of homelessness on health. The Foundation also provides grant funding through our Blue Safety Net program to Project Home Health Services. With the Foundation's support, Project Home Health Services will expand access to high-quality, low-barrier health and wellness care to vulnerable and underserved communities. Another one that we work with is Pathways to Housing, is another amazing organization with a housing-first model, housing people directly from the streets without preconditions, then addressing any underlying issues around mental health, addiction, medical care, income, and education to help integrate and welcome them back into our community. The Foundation support enhances Pathways community-based treatment and support services for people with substance use disorder. For more than 15 years, the Covenant House Pennsylvania Clinic, one of our Blue Safety Net grant recipients, has provided youth who are homeless comprehensive medical care, in addition to offering housing and supportive services to homeless youth since 1972. Lastly, I'd like to highlight one of our past grant recipients, the People's Emergency Center, and 2019 Blue Safety Net grant recipient, Youth Services, Inc. These 2 Philadelphia nonprofit agencies have a long history of providing critical services to children, families, and youth who are homeless in the city. Last year, they announced their strategic partnership. They decided to come together, taking another word, Barry, again, to integrate services and provide a continuum of services to have a greater impact on those served. YSI's Emergency Shelter for Homeless and Runaway Youth is one of only 2 shelters in Philadelphia, serving boys and girls ages 12 to 17, and the only one to also offer medical services on site. As a Blue Safety Net grantee, the Foundation's support enables YSI to continue to provide youth who are homeless with comprehensive treatment for all medical issues. I had the honor and privilege of serving some time ago on the board of the People's Emergency Center that was founded back in 1972. They started then and they're still functioning. PEC is a comprehensive homeless services provider, an experienced nonprofit community development agency based in West Philly. for parents, youth, and children who are experiencing homelessness. PEC provides the social services they need to improve their physical well-being, emotional security, and economic stability while they search for permanent supportive housing. The YSI and PEC affiliation creates a continuum of services for clients of both agencies, making it will be much easier for clients to get the full range of support they need. So rather than have them go one place to the other, it almost to some degree becomes one stop. YSI and PEC currently work together in ways that advance the city's strategies to improve outcomes for children, youth, and families. And while we are proud to support these community organizations through grant making, some of our best work happens outside of grant applications. We convene our grantees for annual partner meetings to facilitate discussions around important health topics. And we are given an opportunity, again, to hear directly from them, to listen. I think that listening piece is so important. We invite our grantees to contribute to foundation publications, such as the Journal of Change, and we also have blog posts where we allow our grantees to write their story. We also focus our communications not only on the work of the foundation, but on the work of the nonprofits we support, as ways we can drive through leadership, inspire, and educate together. Collaboration is one of our guiding principles, and our guiding principles are at the heart of all we do. All our work is made possible through a shared mission with our community partners, and I think we would all agree that we, as I said earlier, we can't do it ourselves. When I think about Chosen 300, which is another homeless group that we work directly with, it's partnering with them where they are, and it's going to where they are. I don't wait for folks to come to 1901 Market Street. I go to where they are. I am often boots on the ground. So we encourage you to learn more about how we actively participate in finding solutions to health issues by visiting our website, exploring all the Foundation's reports and publications, and by following us on Twitter and Instagram. I will end with a quote from one of my favorite sheroes, Dr. Maya Angelou. If you find in your heart to care for somebody else, you will have succeeded. And I often say, don't tell me you care, show me you care. I hope we continue to foster collaboration and connection to make a tangible difference in this world. Again, I thank you for the opportunity to present the Independence Blue Cross Foundation and work that we've been at since 2011. Thank you so much.